Bismillahirrahmanirrahim. The thought of the day is the more that you read, the more things you will know. The more that you learn, the more places you will go. Assalamu alaikum. My name is Dr. Inshrah. I'm a PGR of Community Medicine and Public Health at King Edward Medical University, Lahore. Today, the topic of my presentation is health economics, and I'll be presenting it under current supervision of Professor Dr. Saira. Our learning outcomes will be health economics, basic concepts in health economics, economic appraisal, opportunity cost, health economics and its relation to health system, policy making, and global health economics, challenges in health economics, future of health economics, recent updates, and then MCQs. Learning objectives. At the end of this presentation, the participants will be able to analyze various types of health economics, evaluate fundamental concepts in health economics, compare different types of economic appraisal methods, identify key challenges faced in health economics, and predict future trends in health economics. What is economics? It is the science of production, distribution, and consumption of goods and services. As you can see, whenever there is a production process, there are some inputs in the form of resources like money, time, labor, some mediating factors, and this results in outputs in the form of goods or services. Health economics. Health economics is a field of study that analyzes the allocation of resources within the healthcare sector. It examines how resources are distributed, the costs and benefits of different health interventions, and the impact of policies on health outcomes. Importance of health economics. Health economics is important for several reasons. It optimizes the use of limited healthcare resources, informs evidence-based health policies for better access and quality, aids in managing healthcare budgets and forecasting expenditures, addresses disparities in healthcare access and outcomes, encourages the development of effective and economically viable treatment. Types of economics. As you can see, there are different types of economics like macroeconomics, microeconomics, and then positive economics and normative economics. One by one, we will discuss all of these. First, we will start from microeconomics versus macroeconomics. Microeconomics. Microeconomics in health focuses on individual and firm level behaviors regarding healthcare decisions and resource allocation. It analyzes factors like demand for healthcare, where consumers make choices based on income, insurance, and perceived needs. It also examines the supply of healthcare services, exploring how providers determine service quantity and quality. Key concepts include price elasticity, which assesses how demand responds to price changes, and market structure, analyzing competition and pricing dynamics. Additionally, it investigates the role of health insurance in shaping consumer behavior and overall costs. By applying microeconomic principles, this field informs policies aimed at improving healthcare efficiency, access, and quality. An example of microeconomics in health is the demand for insulin among diabetes patients. If the price of insulin rises, some patients may reduce their usage or seek alternatives, illustrating price elasticity. This demand is influenced by factors like insurance coverage. Those with comprehensive insurance may be less affected by price changes. Healthcare providers may notice a decline in insulin prescriptions and adjust their treatment recommendations accordingly. Macroeconomics. Macroeconomics in health examines the broad economic factors influencing healthcare system and public health outcomes on national and global levels. It analyzes health expenditures as a share of GDP and how economic conditions affect overall spending. The field explores the relationship between economic growth and health outcomes, government policies on healthcare funding, and the impact of demographic changes like aging populations on demand. It also considers how health affects workforce productivity and economic performance, recognizing that healthier populations contribute to stronger economies. Lastly, it addresses international health issues such as pandemics and disparities, guiding strategies to enhance healthcare systems and improve population health. An example of macroeconomics in health is the relationship between economic growth and public health outcomes in a country. For instance, as the nation's GDP increases, it often leads to higher healthcare spending, improved health infrastructure, and better access to medical services. This can result in lower mortality rates and improved life expectancy. Conversely, during economic downturns, reduced health spending may lead to negative health outcomes such as increased disease prevalence and decreased access to care. Moving forward to positive economics and normative economics. Here we will compare both of these types of economics. In positive economics, we deal with the facts, figures, and laws of economics, while in normative economics, we deal with the opinions and value judgments about economic activities. This is a descriptive approach, while this is a prescriptive approach. In positive economics, we deal with what actually is in the situation or scenario. There is some sort of testing, no value judgment, and no use of ethics. In comparison, in normative economics, we don't deal with what actually is in the scenario, but rather what should be in the scenario based on the ethics. There is no testing in this type of economics. There is some value of judgment and use of ethics. Moving forward to their examples. For example, a positive economic statement might be an increase in minimum wage leads to higher unemployment among low-skilled workers. This statement can be tested and validated through observation and analysis. In contrast, a normative economic statement might be the government should raise the minimum wage to ensure a living wage for all workers. This reflects a judgment about the desirability of an outcome rather than an objective fact. In summary, positive economics is concerned with objective analysis, while normative economics addresses subjective value judgments and policy prescriptions. Basic concepts in health economics. Here is a brief overview of some basic concepts in health economics. Scarcity and choice. Scarcity refers to the limited availability of resources like money, time, and medical supplies in relation to unlimited human wants. This leads to choice, where decision makers must prioritize how to allocate these resources effectively to maximize health outcomes. Supply and demand. Supply in health economics refers to the availability of health services and goods, like hospital beds and medications. Demand refers to the desire and ability of individuals to seek out health services. The interaction between supply and demand determines the prices and availability of healthcare services. Elasticity. Elasticity measures how sensitive the quantity demanded or supplied is to changes in price. Based on this fact, there are two types of elasticities: price elasticity of demand and price elasticity of supply. Discounting. Discounting is the process of determining the present value of future costs and benefits. It reflects the principle that people value immediate benefits more than future ones. The discounting formula is PV is equal to FV divided by 1 plus R exponent N, where PV is present value, FV is future value, R is the discount rate expressed as decimal, and N is the number of periods, for example, in years. Sensitivity analysis. Sensitivity analysis assesses how the outcome of a model, like a cost effectiveness analysis, changes with variations in key assumptions or parameters. Example given: cost effectiveness rate. This helps identify which variables have the most significant impact on results and provides insight into the robustness of the conclusions. Economic appraisal. Economic appraisal in healthcare is a systematic process used to evaluate the economic implications of healthcare interventions, policies, or programs. It involves assessing both the costs and health outcomes associated with these interventions to determine their efficiency and value. Its primary objectives are to identify cost, evaluate outcomes, compare alternatives, and assess affordability. There are different types of economic evaluations like cost benefit analysis, cost minimization analysis, cost effectiveness analysis, and cost utility analysis. One by one, we will discuss all of these. First of all, cost benefit analysis. In this method of evaluation, cost of the intervention is compared with the benefit incurred from the intervention. Both cost and the benefit are measured in terms of monetary units. The net benefit is measured as net benefit is equal to benefit minus cost. Therefore, if the benefit exceeds the cost incurred during the intervention should be continued. Example, a health department evaluates the economic impact of a smoking cessation program. They calculate the cost of program, example given counseling materials, and compare it to the benefits such as reduced healthcare costs from fewer smoking related illnesses. If the benefits significantly outweigh the cost, the program is deemed worthwhile. Cost minimization analysis. In this method of analysis, cost of two or more interventions achieving identical outcome are measured. The intervention incurring the lowest cost is then chosen. It should be strictly noted that the intervention can only be conducted when the outcomes of the comparing interventions are same. A study compares a generic medication to its brand name equivalent for treating anxiety. Since both have similar efficacy and safety profiles, the cost minimization analysis focuses on the lower acquisition cost of the generic, recommending it as the more cost-effective choice without further outcome evaluation. Cost effectiveness analysis. In this method of analysis, cost is measured against the effectiveness of the intervention. Effectiveness is the final consequence. The consequences of the comparing interventions may vary here. However, these consequences can be expressed in common natural units like life years gained, saved years of life, etc., or improvement in functional status like units of cholesterol, blood pressure, etc. Researchers compare the cost and health outcomes of two treatments for hypertension, a standard medication versus a new, more expensive drug. They measure the cost per millimeter mercury reduction in blood pressure. If the new drug achieves better outcomes at a reasonable cost, it may be recommended despite the higher price. Lastly, cost utility analysis. In this method of analysis, cost incurred in the intervention is measured against the utility related to health. Utility refers to the quality adjusted life years, disability adjusted life years. This method is specifically used when there are multiple objectives of the program and when both quality of life and quantity of life are important to know. It is also used to make policy level decisions. Example, an analysis of a new treatment for heart failure assesses its cost per quality adjusted life years gained. If the treatment costs $50,000 and results in 2 quality adjusted life years, the cost utility would be $25,000 per quality adjusted life years. This information helps determine if the treatment is cost effective compared to the existing options. Importance of economic appraisal in healthcare. Economic appraisal is crucial for efficient resource allocation in healthcare, maximizing population health benefits. It provides evidence-based insight for policymakers identifying cost-effective interventions and determining the best value for money. By assessing equity, it ensures fair access across different groups. It also aids budget planning by clarifying financial implications of new interventions. And ultimately, economic appraisal enhances accountability and transparency in spending. Moving forward to opportunity cost. Opportunity cost refers to the value of the next best alternative that is foregone when a decision is made to pursue a particular course of action. In other words, it represents the benefits or returns that could have been gained from choosing a different option. This concept is essential in economics and decision making because it emphasizes that resources such as time, money, or labor are limited, and choosing one option means giving up the potential benefits of another. Opportunity cost is critical in healthcare resource allocation as it helps decision makers evaluate the trade-offs involved in choosing one intervention or resource over another. Examples of opportunity cost in healthcare. For example, in surgery versus rehabilitation, if a hospital dedicates its operating room, time, and staff to perform elective surgeries, the opportunity cost is the rehabilitation services that could have been provided to patients needing post-operative care or therapy. Medication allocation. When a healthcare facility chooses to stop a new, expensive medication for a specific condition, the opportunity cost might be the alternative treatment or medication that are no longer available for patients with other conditions due to budget constraints. Public health funding. Allocating funds for a new community health initiative, example given a smoking cessation program, might come at the opportunity cost of reduced funding for another critical service such as mental health program or chronic disease management. Measuring opportunity cost. Direct cost. These are immediate financial implications such as the cost associated with treatment or equipment. For example, purchasing a new surgical machine involves direct expenses like the purchase price and maintenance. Indirect cost represent lost opportunities for alternative interventions. For instance, allocating funds to a new drug may mean foregoing investments in preventive care program or other essential treatments. Health systems and economics. Healthcare system can be classified as public or private, each affecting economic evaluations differently. Public system funded by the government aims for universal access and often provides services at low or no cost to the patient. While they can promote equity and long-term health outcomes, they may also face issues like longer wait times and limited provider choices. In comparison, private systems rely on individual payments and insurance, generally offering faster access and more choices, but often resulting in higher cost and accessibility disparities. These differences impact how economic evaluations are conducted, with public systems focusing on resource allocation and efficiency, while private systems emphasize competition and innovation. Understanding these distinctions is crucial for effective healthcare policy and equitable access. Policy making and health economics. Health economics plays an important role in shaping healthcare policies by delivering evidence-based insight that guides decision making. It enables policymakers to assess the efficiency and effectiveness of various healthcare interventions, ensuring that resources are allocated to maximize health outcomes while minimizing costs. Example, evaluating cost effectiveness of vaccine. When evaluating a new vaccine's introduction, health economists perform cost effectiveness analysis to weigh the costs against the health benefits it offers, such as decreased disease incidence, fewer hospitalization, and overall reductions in healthcare expenses. This analysis assists policymakers in deciding whether to include the vaccine in public health programs, influencing funding and prioritizing decisions. Global health economics. Global health economics examines how economic factors influence health outcomes and healthcare systems across different countries. There are notable differences in health economics due to various factors like income levels and healthcare systems. Higher income countries invest more in healthcare, resulting in better access and outcomes. In contrast, low income countries face infrastructure challenges and limited access, leading to poor health outcomes and higher disease burdens. Healthcare systems. Healthcare systems differ globally, with a universal system prioritizing equitable access and privatized ones emphasizing efficiency. These differences impact resource allocation, care cost, and health outcomes, necessitating tailored economic strategies for health challenges. Importance of data in health economics. Data is crucial in health economics, encompassing clinical, economic, and epidemiological types. Clinical data assesses treatment outcomes. Economic data captures cost for cost effectiveness analysis. Epidemiological data identifies health trends and disease prevalence. Key resources include surveys for self-reported information, administrative data from health records for utilization and cost analysis, and clinical trials for evaluating the efficiency of interventions. This data integration informs policy and enhances healthcare outcomes. Moving forward to challenges in health economics. First of all, there is data limitation. Inaccurate or incomplete data can significantly hinder economic evaluations in healthcare. Reliable data on costs, outcomes, and patient demographics are essential for informed decision making. However, gaps or inaccuracies can lead to flawed analysis and misguided policy decisions. Variability in healthcare outcomes. Healthcare outcomes can vary widely due to factors such as patient characteristics, treatment setting, and disease complexities. This variability complicates the comparison of interventions and makes it challenging to draw generalizable conclusions about cost effectiveness. Ethical considerations in economic evaluations. Ethical dilemmas arise when evaluating healthcare interventions, particularly regarding how to value human life and health outcomes. Issues such as equity, access to care, and the prioritization of certain populations can complicate economic assessments, raising questions about fairness and justice in resource allocation. These challenges necessitate careful consideration and methodological rigor in health economics to ensure valid and equitable conclusions. Resistance from stakeholders. Stakeholder resistance is a major barrier to implementing economic evaluations, stemming from concerns that cost effectiveness analysis might reduce funding for essential services or restrict access to treatment. Competing interests and differing priorities among healthcare providers, policymakers, and patients can also complicate consensus on evaluation priorities and actions. Lastly, integration into existing healthcare frameworks. Integrating economic evaluations into healthcare systems is challenging due to insufficient infrastructure and training. Many systems lack the capacity to regularly conduct these evaluations, and staff may not be equipped to interpret and apply economic data. Without clear pathways for utilizing evaluation results, their potential benefits for healthcare delivery and resource allocations remain largely untapped. Now, future of health economics. The future of health economics is increasingly shaped by big data and advanced analytics. The growing availability of large data sets allows for more robust analysis of healthcare utilization, outcomes, and cost, leading to improved decision making and policy formulation. Artificial intelligence plays a significant role in this evolution by enhancing economic evaluations through predictive modeling and automation. AI can analyze complex data patterns, identify cost-saving opportunities, and streamline resource allocation, ultimately improving efficiency and patient outcomes in healthcare systems. Together, these advancements promise to transform health outcomes into a more dynamic and evidence-based field. Now, recent updates. Highlight from the Pakistan Economic Survey 2023 to 24. Government is committed towards universal health coverage. In this regard, Global Health Summit was conducted by Pakistan with the coordination of Asian Development Bank in Feb 2024. An amount of 25.3 billion rupees was allocated to health sector in PSDP of fiscal year 2024. During the period July to May in fiscal year 2024, 68% of the allocation has been released to concerned authority. The total public health expenditure during fiscal year 2023 amounted to 843.2 billion, that was 1% of the GDP against 919.4 billion last year. The government has launched a 3-year national multi-sector nutrition program to reduce stunting and other forms of malnutrition with an allocation of rupees 8.5 billion. This program is scheduled for implementation across 36 districts burdened with high rates of stunting affected by calamities. Public health expenditure, financial development and health outcomes in Pakistan and analysis. The results reveal that public health expenditure and financial development affect health outcomes in long and short run. Using the error correction mechanism for estimation of short run relationship revealed that life expectancy, infant mortality, under 5 mortality have inverse and statistically significant relationship with both public health expenditure and domestic credit to private sector to GDP ratios, which means life expectancy, infant mortality, and under 5 mortality will adjust more quickly towards equilibrium in long run. We suggest the Ministry of Health Pakistan to conduct more consultations with other ministries and other stakeholders in health services as to identify the needs and emphasize on the importance of health programs to the society. The use of evidence to design an essential package of health services in Pakistan, a review and analysis of prioritization decisions at different stages of the appraisal process. Pakistan embarked on a process of designing an essential package of health services as a pathway towards universal health coverage. The essential package of health services design followed an evidence-informed deliberative process. Evidence on 170 interventions was introduced among multi-stages of appraisal engaging different stakeholders tasked with prioritizing interventions for inclusion. Quantitative evidence on cost effectiveness, budget impact, and avoidable burden of disease was presented to stakeholders in stages. We recorded which interventions were prioritized and deprioritized at each stage and carried out analysis. Value for money generally increased throughout the process, although not uniformly. Stakeholders largely prioritized interventions with low budget impact and those preventing a high burden of disease. Highly cost-effective interventions were also prioritized, but less consistently throughout the stages of the process. Interventions with high current coverage were overwhelmingly prioritized for inclusion. Recommendations for emerging good practice and future research in relation to family and and caregiver health spillovers in health economic evaluations, a report of the SHEER task force. Omission of family and caregiver health spillovers from the economic evaluation of healthcare interventions remain commonly practiced. To promote emerging good practice, this paper from the spillovers in health economic evaluation and research, SHEER task force aims to provide guidance on the incorporation of family and caregiver health spillovers in cost effectiveness and cost utility analysis. Sheer advocates for the incorporation of health spillovers into analysis conducted from a healthcare or health payer perspective, and more generally, inclusive perspectives such as societal perspective. Where possible, spillovers related to displaced or foregone activities should be considered, as should the distributional consequences of inclusion. Currently, the allocation of primary spillover data is preferred, and clear justification should be provided when choosing secondary data. Transparency and consistency when reporting on the incorporation of health spillovers are crucial. Johns Hopkins Bloomberg School of Public Health is offering master's degree of health science in global health economics. With increasing globalization, there is growing need for health economists who can translate research into policy and directly inform governments and organizations on the best course of action. The MHS in global health economics in the Department of International Health Studies learn how health and economics principles and applied health cases from around the world are used to address global issues such as migration, displaced persons, climate change, vaccine access, injuries, and pandemics. They'll also learn how health economics can be used to promote healthy lifestyles, positive health outcomes, and equitable access to care. Moving forward to the multiple choice questions. A health policy team is evaluating the significance of health economics in shaping healthcare systems. They want to understand how health economics contributes to effective healthcare delivery. Which of the following statement best captures its importance? A. Health economics solely focuses on reducing healthcare costs. B. Health economics guides evidence-based decisions to optimize resource allocation and improve health outcomes. C. Health economics primarily concerns itself with profit maximization for healthcare providers. D. Health economics aims to limit access to healthcare services for better management. Or E. Health economics encourages the development of luxury healthcare facilities.
B. Health economics guide.
The correct answer is beta. A health insurance company is considering introducing a new policy that incentivizes preventive care visits to encourage members to seek regular checkups and screening. This initiative aims to reduce long-term healthcare costs by promoting early detection of health issues. To ensure its success, the company must understand the factors influencing consumer behavior regarding preventive services. In this context, which microeconomic factor will most influence consumer behavior? A. The structure of the healthcare market. B. Availability of healthcare providers. C. The perceived needs of preventive services. D. Historical spending on healthcare. Or E. Government regulations.
C.
Yes, the correct answer is Charlie. A government is reviewing its healthcare funding policies due to changing economic conditions, aiming to enhance public health outcomes. To make informed decisions, they need to understand the economic factors influencing healthcare spending and health results. What macroeconomic relationship should they examine? A. The effect of competition on service quality. B. Patient demand for specific healthcare services. C. The influence of private insurance on public health. D. Historical trends in healthcare pricing. Or E. The relationship between economic growth and health outcomes.
E.
Yes, the correct answer is ETA. A healthcare provider is considering whether to continue a diabetes management program. They must weigh the cost of the intervention against the benefits realized through reduced hospital admissions. If the benefits are found to exceed the cost, what should be the decision? A. Continue the intervention. B. Discontinue the intervention. C. Revise the intervention strategy. D. Increase funding for the intervention. Or E. Conduct more research.
C. Charlie. A.
The correct answer is alpha. A healthcare policy group is tasked with determining whether to adopt a new, more expensive drug for hypertension treatment. They find that while the new drug costs more, it results in significantly better health outcomes. What conclusion might they draw based on cost effectiveness analysis? A. The new drug should be avoided due to its high cost. B. The standard medication is more effective and should be preferred. C. Costs are irrelevant in this analysis. D. The new drug is worthwhile if it achieves better outcomes at a reasonable cost. E. If further study is necessary to assess long-term outcomes.
D.
Yes, the correct answer is delta. A public health department is facing significant budget constraints and must make a strategic decision on how to allocate its limited resources effectively. The department has two primary options for funding: a vaccine campaign aimed at preventing the spread of infectious disease in the community, or a health education program designed to promote healthy lifestyle choices and disease prevention. What would be the opportunity cost if they decide to go for the vaccination campaign? The total amount of spent on the vaccination campaign. B, the cost of the health education materials. C, the potential health improvements from the education program. D, the public response to the vaccination campaign. Or E, the salaries of the staff involved in both programs. The correct answer is Charlie. A state health department is considering implementing a new diabetes prevention program. They gather a team of health economists to evaluate the program's potential costs against its expected health outcomes, such as reduced hospital visits and improved patient quality of life. The team aims to provide evidence to help policymakers decide whether to fund the program. What key role does health economics play in this evaluation? A, it focuses on increasing public awareness of diabetes. B, it advocates for the interest of healthcare providers. C, it emphasizes historical data on diabetes management. D, it solely examines patient satisfaction scores. Or E, it analyzes the effectiveness and cost efficiency of the program.
E.
Yes, the correct answer is ETA. A researcher is conducting a comprehensive investigation into the relationship between income levels and health outcomes across various countries. Their findings indicate a clear trend. Higher income countries generally experience significantly better access to healthcare services and improved health outcomes. Which underlying reason should they explore further? A, availability of traditional medicine. B, political stability of each country. C, public awareness of health issues. D, investments in healthcare infrastructure. Or E, prevalence of private insurance options.
B.
The correct answer is Delta. An economic evaluation of new public health intervention raises questions about how to value human life and prioritize access to care. Policymakers express concerns about fairness in resource allocation and the impact on vulnerable populations. What challenge does this situation reveal? A, integration of evaluations into existing frameworks. B, ethical dilemmas in economic assessment. C, data limitations in healthcare evaluations. D, variability in treatment options. Or E, resistance from healthcare stakeholders.
E.
Correct answer is beta. A healthcare organization is integrating artificial intelligence into its economic evaluation process. The AI system is designed to analyze complex data patterns and identify cost-saving opportunities in real time. How does this integration of AI enhance health economics? A, by improving efficiency and streamlining resource allocation. B, by eliminating the need for human oversight. C, by standardizing all healthcare interventions. D, by focusing solely on patient satisfaction. Or E, by increasing healthcare costs.
A.
Yes, the correct answer is alpha.
Alpha.
These are the correct answers of all the MCQs. This is the link to our YouTube channel. Kindly like and subscribe. Thank you for your attention.